This is Green Street, the environmental health show, greenstreetnews.org, Patti and Doug Wood, and our worldwide network of experts, here every week to help you navigate your way through this increasingly toxic world. And speaking of toxic worlds, for decades, people have been searching for a cure for breast cancer. Marching, shopping, racing, golfing, doing whatever they could to support finding a solution to the dreaded diagnosis. But what if the answer was right under our noses? Today on Green Street, we'll talk with two women from the nonprofit Breast Cancer Prevention Partners about their work to help women understand the links between chemicals in the products we use every day and the development of breast cancer. It's a show you won't want to miss, so call your friends and stay tuned. But first, some of the headlines of the week. Patti, what do you got for us this week?
Well, I have a follow-up to one of the articles that we talked about last week on attribution science.
Yeah, this is about climate change, right?
Yeah. This is about climate change. So This is from Inside Climate News.
Which is a great source of information.
It's a great source, okay, and written by Dennis Pillion. Trump lashes out at National Academies of Sciences over climate guide for judges. President Donald Trump took to social media to express his displeasure with one of the nation's preeminent scientific bodies over a manual issued to help judges understand climate science. The manual, produced last year by the National Academies of Sciences, Engineering, and Medicine, a congressionally chartered independent organization that advises the U.S. government on science and technology, cites the United Nations Intergovernmental Panel on Climate Change, their assessment that there is little doubt that fossil fuel emissions directly contribute to climate change, noting that the panel is generally viewed as the leading scientific authority in the field. The panel concluded, quote, "It is unequivocal that human influence has warmed the atmosphere, ocean, and land, and this has caused widespread changes in the atmosphere, the oceans, cryosphere, and the biosphere."
Yeah, and Donald Trump didn't like that, right?
That's right.
Let me guess. He had a real problem.
Yeah, he did. In a post on Truth Social, Trump said the report was political fraud and false science. His post did not list any specific claims that he disputed, nor did he cite any examples of malfeasance on behalf of the researchers who compiled it.
Patti, he doesn't read. You know that he didn't read this thing, right?
I get it. Instead, Trump posted that the NAS was run by, quote, radical left Democrats, and that the manual had been totally discredited.
It's like a high school kid, you know?
I hereby order federal suspension and debarment officials to review this conduct, Trump said in the post.
He's going to disbar these people.
Who knows what he's going to do, okay? All right, so, though the manual in question is not new, Trump made his post just days after another NAS report concluded that scientific advances over the past decade have, quote, strengthened the foundation for extreme event attribution, or how much climate change impacted specific extreme weather events. That's what we were talking about last
attribution
week.
Science.
Mm-hmm. Yep. Climate scientist Michael Mann praised the NAS report as, quote, a comprehensive and objective assessment of attribution science compiled by a blue ribbon panel of highly respected leading experts. Trump, in his second term, has continued to assail mainstream climate science and elevate fringe views, downplaying or denying the negative impacts of climate change.
It's a fraud. Climate change is a fraud. Don't believe what you see. Don't believe what you see with your own eyes, right?
No, well, last week when we had these smoke events from the wildfires in Canada and in the U.S., I said, and lots of other people said, this is going to be the new norm. Our kids are going to live with this.
That stuff is really dangerous.
It's really dangerous.
All right. Thanks, Patti.
You're welcome. One in 8 women today will be diagnosed with breast cancer, yet most breast cancer cases are not linked to genetics. As breast cancer researcher Dr. Anna Soto once told me, we don't share our genes, but we do share our environment. Leading the effort to prevent more women from a diagnosis of breast cancer is a California-based organization called Breast Cancer Prevention Partners. The other day, Doug and I had a chance to speak with two of its principals, Nancy Buermeyer and Laura Gillan, about the organization's mission and its current programs.
We asked Nancy to start giving us an overview of the organization and its mission. Here's our interview with BCPP's Nancy Buermeyer and Laura Gillan.
Breast Cancer Prevention Partners has been around for over 30 years, and our mission is specifically focused on primary prevention of breast cancer by reducing the exposure to toxic chemicals that have been linked to an increased risk of the disease by the peer-reviewed science. So we are a science-based organization. We have a science team in-house that looks at all the peer-reviewed science and makes it understandable for the general public. And then we base our policies and market campaigns on that science in a way to try to reduce the daily exposures that we are all having around chemicals linked to not just breast cancer, but lots and lots of other chronic diseases.
Yeah, well, that's pretty much it. And I mean, the fact is that we're surrounded by these chemicals and we have so much information, not necessarily drawing a causal link, but certainly an association between exposure to these chemicals and the development of all kinds of cancer, including breast cancer. How are you getting the message through to women?
You know, I actually think that people are more and more understanding at a sort of instinctual level that these chemicals are in everything around us and that they are impacting our health. And I think that's something that the public is becoming more aware of. They understand those connections. That said, there's still a lot of work to do around individual chemicals. Certain chemicals have broken through, I think. So bisphenol A or BPA is something that lots of people know about, and you can see little BPA-free stickers on plastic items in the store. And also forever chemicals, perfluorinated chemicals, or PFAS, is another chemical that has had a lot of news coverage. But we continue to put the science out there, create tips for people to reduce their own exposures in their daily lives, while always saying that we can't sharp our way out of the problem, that the exposures that we have are ubiquitous. We can make certain choices to reduce our exposures, but ultimately we need industry to stop making products with toxic chemicals and the government to better protect us.
Yeah, I think a lot of people assume that the government wouldn't allow products on the market, right, if they have a link to cancer. But clearly that's not true. Industry has an awful lot of influence in Washington, and products that probably shouldn't be allowed on the market are allowed on the market. And so we go. What are the kind of the biggest challenges that you have as an organization?
We are a small organization fighting huge industries. We focus a lot on consumer products, chemicals in consumer products, because it's what we interface with every day and it's sort of tangible for folks. But those chemicals are also in our water, our air, our soil, our workplaces, our homes. But there's a lot of influence from corporate America on the policymakers that we interface with, both at the federal level and at the state level. And having to overcome those arguments, you're going to lose jobs, that's going to cost more money. Those are frequently the arguments industry uses. But we find that when we actually do pass laws to protect folks and take these chemicals out, life goes on and products are still available on the shelves and people can still afford them for the same price they paid before they took the toxic chemical out.
Yeah, and of course, we know of companies that make the same product with two different types of ingredients. One set of ingredients for the European Union, where chemicals aren't allowed, another for America, where we allow pretty much whatever you want to put in, which is
right. Right. And that's, that's based on the precautionary principle, which we do not engage with in this country at all. And then, of course, there's the regrettable substitutions, right? So big thing about BPA. BPA is so toxic. It's an endocrine disruptor. Oh, my goodness. So now when you shop, you see little labels on products that says BPA free, but it has BPS and BPF and BPX and all the other, bisphenols that, are in the same category, the same class, and have the same, if not more, toxicity to them than BPA.
You're absolutely correct. That is absolutely a great example of that. We're working on a bill in California around thermal receipt papers. So thermal receipt paper used to be made with BPA, but then BPA got a bad name. So now 80% of it's made with BPS, which is
Right.
why
Of course.
as a movement, there's been a big move towards trying to regulate chemicals as a class.
Right.
And perfluorinated chemicals, or PFAS, was the very first example of that. But we are now working more and more on banning things like phthalates and bisphenols and other classes of chemicals as a class instead of individually because of that regrettable substitution
So
issue.
tell me, how far are you getting with this? Because we hear about working with agencies, federal agencies, on banning these chemicals as a class, like PFAS, right? And like the bisphenols. But what's happening?
So a lot of the action is happening at the state level to regulate different combinations or different classes of chemicals in different product categories. So PFAS alone, in California, we've passed bans on firefighting foam, paper-based food packaging, textiles, cosmetics, and a series of other product categories. So a lot of it is happening at the state level because Congress is not very functional right now. We did get a ban on certain phthalates and kids' toys through Congress back in 2008. And there was an upgrade to the Toxic Substances Control Act in 2016, which is now under threat from the chemical industry trying to reverse any progress we made in the 2016 bill. So we've been playing a little bit more defense at the federal level at this point, but we have been making amazing progress at the state level.
So I want to bring Laura into the conversation. Laura, can you tell us a little bit about what BCPP is doing in the medical world?
Yeah, I mean, it's so important. I mean, you go into a hospital or a doctor's office, even when you go to like an alternative medicine doctor where you're going in for, for vitamin C IVs, talk a little bit about what's happening there.
Sure. About 90% of hospital patients do receive an IV. So this is a potential for a very large exposure across the US. And 70% of those IVs actually are PVC based. So PVC is very hard by nature. And in order for it to become a flexible IV bag, you have to add a plasticizer to that. And in this case, it's typically DEHP, a phthalate, that we banned from children's toys in 2008. It's still present in our IV bags. So California introduced the California Toxic Free Medical Devices Act in 2024 that passed. It will implement a ban on DHP and IV bags by 2030 and IV bag tubing by 2035. Shortly after it passed in California, it passed in North Carolina. And then right now in Massachusetts, the same bill sits on the governor's desk and hopefully will be signed into law in the next week. There's about 7 or 8 other states who either have introduced similar language or are planning to introduce. So just like Nancy mentioned, like the states are really leading the way in toxics reduction.
Yeah, not surprising. The federal government has definitely dropped the ball.
So let me just ask you another follow-up question on these IV bags. Is there anything in these pieces of legislation that actually address the vulnerability of infants in neonatal units?
Yeah, absolutely. It's actually mentioned in the bill language to prioritize these departments. So NICU departments, oncology departments. We know that for infants, they're very small. And so the exposure per body weight is very, very high. And there's these incredible, like most of the scientific studies linking DHP to health harm is focused on NICU patients, actually. And we see that it's something like 160,000 times over the safety threshold set for DHP that NICU infants can actually be exposed to.
But this is crazy. When an industry can just, spend a few more cents to make a non-toxic IV bag. What is going on?
This is going to be especially startling, Patti, is that all 4 IV manufacturers actually offer a DHP-free IV bag as part of their portfolio.
Right, and nobody buys it, right, because it's more expensive.
Baxter has continued to double down on their PVC bags, and it makes up the largest part of their portfolio versus this DHP-free version that they have offered. Also startling in our outreach, because we actually have this National Toxic Free IV campaign now that goes beyond legislation, and it's working with healthcare systems to actually make that transition to safer IVs before legislation comes to their state or the timeline hits for their state if legislation has already passed.
Wow.
And we've heard in these conversations that actually some IV bags are color coded. So then the nurse knows which departments to use it for. So maybe there's like a yellow label on an IV bag that goes to the NICU. So they are getting the DHP free version of the IV bag. But
You're still getting PVC, right?
it is a PVC bag.
Doesn't leak?
It doesn't migrate. But the plasticizer is still the problem. So if not DEHP as the plasticizer, what is it? And this goes back to your regrettable substitutes. There are IV bags on the market. There's like very good supply of safer IV bags that aren't made out of PVC. And the thing is, when you don't have a hard plastic like PVC to start with, you don't need a plasticizer.
Correct.
So the safer alternatives doesn't need that ever. There's no possibility of leaching because the plastic itself is made to be flexible to begin with.
One thing I'll quickly add, because PVC, while it may not leach while it's in use, it is one of the most toxic plastics on the planet.
Yeah, I know.
What Doug talked about. So the sort of newer incarnations of the legislation that we're pushing would also ban PVC in IV bags and begin the process of getting PVC out of IV tubing. Not all tubing is, there aren't substitutes for all PVC types of tubings, but where we can, we're trying to get PVC out of that entire ecosystem. Wow. The other thing I'll just quickly note on the regrettable substitutes is while we focus on the phthalate DEHP because that's what's typically used, the bills also ban replacement with any other phthalate. So there is a sort of class approach to how we put that together.
So these are national campaigns that you kind of have going. What else is kind of on your menu of campaigns that you're working on?
I'll talk about the Safer Beauty Bill package in a second, but I just wanted to show you kind of an example of how we're up against this big industry. So the cosmetics industry is worth more than $350 billion. $350 billion now. And then the clean beauty is growing, but is a small fraction of that. And they're about $10 billion. And so we have this Safer Beauty Bill package that we have actually partnered with a number of incredible clean cosmetics CEOs and brought them to DC to be the face of the cosmetics industry because they're playing by the rules of consumers' health. They keep them at the most forefront. So they're not using ingredients that are toxic compared to the rest of the industry. So we want to make them the face, and we want the representatives and senators to come talk to them first when they're thinking about cosmetic safety regulation. In 2022, MOCRA passed the Modernization of Cosmetics Regulation Act, and that really set the foundation. It's what brought cosmetic safety regulation into the 21st century because previous to that, it hadn't been updated in over 80 years. Since 1938, and at that time, it was only 2 pages of federal law to cover this hundreds of $billion industry. And so MOCRA set a foundation, but the Safer Beauty Bill package builds the rest of the house, in my mind, because MOCRA left some major gaps. And the 4 bills that we have under the Safer Beauty Bill package will ban the most hazardous cosmetic ingredients, improve fragrance ingredient disclosure, strengthen protections for communities with disproportionately high exposures like women of color and salon workers, and improve transparency throughout the cosmetic supply chain. All of those were not addressed in MOCRA. MOCRA really didn't focus actually on ingredient safety. It was simply cosmetic regulation. So having facilities register their products and ingredients, and the FDA has mandatory recall authority now over products that are unsafe. But it doesn't actually address the gaps of environmental justice or our ingredient exposure.
I think the American public thinks that the FDA approves all of these ingredients before they get put on the market.
I'm sure they do.
That sort of makes the most sense. It's not actually the case. They don't approve any of these ingredients before they go on the market.
Right.
Mm-hmm. Mm-hmm.
And Laura, how many have they regulated or banned?
Yeah, this is just jarring. So we compared against the EU that has precautionary principle, which has over 2,500 chemicals that are banned or restricted from cosmetics. But in the US, we have around 13 chemicals in the US that are banned from cosmetics.
13 as opposed to 2,500.
That's correct.
Right.
Yeah.
So I have this website in the back of my mind that I've been working on for a long time called Your Life, Your Choice. It's for teenagers in their high school health education classes. And one of the sections is My Look. So we interviewed a bunch of kids to see what they put on their bodies. By the time they come down to breakfast in the morning, it's an average of 17 different things that they have actually put on their bodies, from deodorant to, shampoo to, conditioner and whatever else they use, spray and, makeup, and it just goes on and on and on. And that was pretty consistent, from kid to kid.
That's remarkable. That's higher than I would have thought.
Yeah, in fact, Patti, interesting point. Let's talk about that. Kids start using beauty products at a pretty young age. Tell me about BCPP's effort to reach out to young kids.
The vulnerable ones.
There's direct evidence that these chemicals in these products are in our bodies. And the science is very strong, from a combination of lab science to epidemiological studies showing that the presence of these chemicals are linked to an increased risk of breast cancer and many, many other diseases. So one of the ways we're trying to reach out to younger audiences is through a project called Protect Our Breasts. And it's an effort to work with college age and more, we hope, high school age students to engage them in these conversations, to educate them about the chemicals and the products that they use, and use their energy, enthusiasm, and frankly, outrage to try to move not just the education needle, but also the policy needle, and trying to get them as really powerful advocates talking to their policymakers, their legislators at the state and federal level. So we're really excited about that project. As I said, it's fairly new for us, but we have big plans to try to expand that as much as possible.
So Laura, could you tell us a little bit about the campaign for safe cosmetics?
I think the campaign for safe cosmetics, since it's been around for a couple decades, over 20 years now, there have been certain initiatives in time where we've really gotten to lean in and work with high schoolers and teenagers. And we also are a part of this amazing initiative called the California Alliance for Children's Environmental Health. And we work with lots of students who are with PERG and universities to bring them to Sacramento to advocate for a number of environmental health laws. So it's a really valuable experience, and the representatives want to hear from high schoolers. They hit a little bit differently and more meaningful hearing from the youth.
That's great.
Okay, let's talk about the food bill. I love this. Go.
Okay, so we just reintroduced a bill that had been introduced in a previous Congress called the No Toxic Chemicals in Food Packaging Act. It's a federal bill in Congress that was introduced in the House by Jan Schakowsky and Rosa DeLauro from Illinois and Connecticut, respectively, and in the Senate by Senator Blumenthal, who's from Connecticut. And that bill is based on what the FDA should be doing with current law. So current law, there's a provision called the Delaney Clause that was passed in 1958.
Yeah.
And it said that the FDA was not supposed to approve any chemical for food packaging or food additives that's linked to cancer. In spite of that, there are 25 different chemicals that were identified by a report done by the Environmental Defense Fund that are clearly carcinogens. So in federal regulation, it is legal to use asbestos, styrene, benzene, chloroform, formaldehyde, methylene chloride, and the list goes on. Those are just some of the chemicals that folks have some familiarity with, or that, frankly, I can pronounce. So the fact that it is still legal to use all of those chemicals in food packaging is outrageous. And so what this bill seeks to do is say those chemicals are all banned. And there's also 3 classes of chemicals. So bisphenols, phthalates, and PFAS are also in this bill and banned in this bill. It would ban all of those chemicals, and then it would also require that the FDA be assured that whatever replacements are coming in are actually safer, to try to get beyond that concern about regrettable substitutes. And then finally, it makes sure that the states can continue to act in this arena, because one of the big things we're fighting against right now in this Congress is this concept of preemption, where the federal government says to the states, you can't do anything more to protect your people, your citizens and your residents. And in fact, we're going to undo whatever you have done.
I know there's been some concern about the impact of light and its impact on, melatonin and its impact on breast cancer.
Yeah, LED lights is really important from a breast cancer perspective. So are you diving into that also?
We did a report a few years back called Paths to Prevention that looked at all of the different risk factors for breast cancer, compiled the science, and then put together recommendations. In the process of doing that, we did pull together the science around what we refer to as light at night. And when we go and talk to audiences, which we do a lot, and we talk about all of the different risk factors, light at night is by far the thing that most surprises people because it is incredibly well documented.
Mm-hmm.
We don't use the word causal very often. We don't very often say that something causes breast cancer. But in this case, the evidence is so strong that we are in a position to say light at night causes breast cancer. And it's both that ambient light of your neighborhood, but it's also shift workers that have to work at night and then, sleep during the day. And how we address it is not as well understood. Certainly things like super bright lights outside that are on all night long is a clear one, but, people do need to work night shifts. Like that's an important thing, both economically and for our society to function. So we need to learn a lot more about how do you mitigate those concerns for people who are in a position where they need to work at night? Is it getting out in the daylight during the day? Is it not doing the same shift for a certain number of years? But light at night is definitely an important risk factor that most people don't know about.
So, Nancy, is there anything that we haven't covered today that you wanted to make sure we did get a chance to talk about?
The one issue I did want to highlight one more time, because it's very current right now in Congress, is this effort by the chemical industry to use this Congress to roll back the few protections we have in place from under the Toxic Substances Control Act. So the major bill that's supposed to protect us from toxic chemicals is the Toxic Substances Control Act. It was amended 10 years ago through a very robust process. And it is, in fact, providing more protections for folks, including having the EPA affirmatively decide a chemical is safe before it goes on the market. And right now, the chemical industry is doing everything that they can to get Congress to roll back those protections that we got in place 10 years ago.
Yeah.
So there's a coalition of groups out there trying to urge all of our members of Congress to not reopen that bill. And so we would love to have folks get in touch with breast cancer prevention partners. The easiest way to do that is to go to our website, which is bcpp.org. And that website has a ton of information. If any of the subjects that you heard today are of interest, there's more information on our website, including a glossary of exposures for all of the chemicals and the evidence showing the connection to breast cancer, and information about all of our policy initiatives that we talked about today.
Great.
And on our website, you can go to get involved and you'll see a number of options. We have a Take Action Center where you can actually send a letter to your representative asking for them to support or co-sponsor some of these bills that we have in Congress. We have a number of exciting actions. So I recommend people go there to help us make systemic change happen for public health and protect everyone.
Nancy Buermeyer and Laura Gillan of Breast Cancer Prevention Partners talking about the organization that seeks to inform women about the links between environmental exposures and breast cancer. You can learn more about BCPP at bcpp.org. That's going to do it for our show today. Thanks to Nancy Buermeyer and Laura Gillan and all of you who listen to and support this show. Patti and I will be back next week with another edition of Green Street. Thanks for listening.